At the beginning of the pandemic, now about 2 years ago, I made a comment that the COVID train was out of the station, and by covering our faces and by separating from one another, social distancing, we could turn that train around. Well, the train's coming back. This is very much like the beginning of the pandemic again. And this time it's going to flatten us, quite honestly, and we need to be prepared for that. And the same measures that we've been talking about for a long time are the ones that are going to protect us, but we recognize that some people are not going to be able to protect themselves because they're immunocompromised or the vaccine doesn't work as well in particular individuals. And also, others will choose not to be protected. And so we're here to serve. The numbers that we're experiencing in the past 2 weeks have exploded. Fortunately, we're starting from a low level. We're calling this COVID surge number 5. COVID surge number 4, which really decreased significantly, ending approximately 1 to 2 months ago, not even. We at Saint Alphonsus Health System got down to an inpatient COVID volume below 20. In the past 2 weeks, we've seen that number now escalate significantly to over 40, and today's number is 43. So that's a 100% increase in total inpatient COVID volume in 2 weeks. Consistent with that also, as Dr. McGeorge commented, the number of employed people on our teams that are getting COVID has also exploded. And this is in the context of having a little bit more flexibility and allowing people to return to work, because we've learned in the past year how to protect our colleagues from acquiring COVID in our facilities and protect patients and staff from spreading COVID to one another. So despite that, we had seen essentially single digits of employees 2 weeks ago that were on COVID leave, and now our number is up to 125. So we've gone from 14, to be specific, 2 weeks ago, single digits a month ago, and now 125 on COVID leave today. That's going to have very dramatic implications in our ability to take care of patients, obviously. And in a moment, I'll ask my colleague, Dr. Nasser, to talk about some of that. But the reality of the hospital situation then is going to be what I presented in previous surges: longer lines for care, longer time periods to be seen, fewer beds available, expansion of staff to take care of more patients. And in this case, if this trend continues, and we expect it to do so, we will be further impaired from accommodating the same number of patients we're able to take care of during surge number 4. So at Saint Alphonsus Health System, we maxed out at about 170 COVID patients across all of our hospitals. And those of you who remember news conferences at that time will remember we were in the throes of crisis standards of care and risking triage and actual rationing of care, which never happened. I hope to God that that doesn't happen again, but I'm afraid it may this time because our resources are more constrained, our flexibility is less, and functionally that means we're going to be able to care for fewer patients. So we're likely to need to go into crisis standards of care sooner with this surge than we were in surge number 4. The last thing that I want to comment about is the effectiveness of the COVID vaccine. So I've given you a lot of very sobering numbers. I can give you more if you care to hear them, but what I want to talk about is the positive here. What we know is that on a per capita basis, despite this massive amount of Omicron spread, the number of cases that are converting into hospitalizations and death is fewer. So why is that the case? It's because people are vaccinated and boosted. And among our own employed medical staff, doctors, nurses, advanced practice professionals, technicians, and others, we have attained at Saint Alphonsus Health System 100% compliance with our vaccination requirement. And in that context, compared to the community at large, those who are requiring medical care, even if they have a breakthrough infection, are much lower. And so we're able to keep our people working and taking care of the patients they need to care for. So big picture, very frightening. Little picture, we've done the right things to prepare for this as best we can, and we will continue to serve the community.